Evening all, a warm welcome from online dentistry. Yet another webinar on lockdown time. Thanks so much for coming in large numbers again, 150 candidates at this point of time, and this has been repeated more, maybe 5 to 6 times again. And it's also a very clinically oriented topic. At least you should have the knowledge what is happening, and you should think about its application in the future. You can change the industry altogether, especially in this COVID situation. I should say one of the least aerosol production procedure is clear aligner, because all you need to take is an impression, and you send to the lab. Rest is done by the lab. So in that way, if you see, not even any bracket change or any bracket pop off, nothing is going to happen. So follow the protocols what Dr. Binu is going to do. So today we have again our faculty. Main faculty is Dr. Binu. He's an orthodontist, as you all know. Now I do not repeat it again for formality sake. I'm just doing it. For the past 22 years, he's having his exclusive orthodontic practice in Kerala, Alva. So this is the folk online dentistry, which has been started around 2008. We have started. We have so many members all over the world who have attended our courses and doing well. And really, thank you for coming. And over to Dr. Binu. You can take the session from here now.
Yes, thank you so much, Ravi. Thank you so much. 101 session of the lockdown period.
Binu, it is 102. Today I had one more session.
Oh, yeah. I missed it. Sorry. Yeah, 102 of the lockdown period. Yeah. Okay, so guys, my topic today is actually on the point that change is inevitable. A change is inevitable. Change is happening in every field. Dentistry, oh my God, big changes happening. I mean, everybody is struggling and complaining that because of COVID, you can't practice, a lot of problems happening. Let me tell you, it's a change for the good. It's a positive. Look at it positively. For the first time, people are going to call up a dental clinic and say, sir, when can I come? Is it safe to come in, doctor? So the things are going to change. They're going to call up a barber shop and fix up an appointment soon. So things are going to change for a good, for good of dentistry. No doubt about it. Change is inevitable. You know what? You guys are changing without even you knowing. You change from this conventional glass winding stuff to this. You automatically, you changed it. You change from this to this. You change in dentistry, you change from your manual, the IOPA washing stuff to the RVGs. You changed without even knowing. It just happened. You changed from your conventional frenectomy procedure, which involves a lot of blood, to lasers. You changed. Things are happening. Things are changing. My topic is about why not change from the conventional braces to this simple plastic tray called as clear aligners. Conventional braces versus clear aligners. That's my topic today. But as I told you, my topic is more oriented towards change. Change is inevitable. And one more thing. My topic today is not going to just give you complete details about clear aligners, but what I've done is I have divided that into one classification, that is the differences between the major advantages of a clear aligner over conventional straight line. So let's look at advantages directly. Let's go to case discussions. That's what we, myself and Dr. Jawabi, do all the time. We always look into case discussions rather than talking too much of theory. Let's go to a case. 25-year-old female with a complaint of a beautiful profile. Yeah, look at that, beautiful profile, and complaints of crooked teeth. 25-year-old female coming to your clinic with crooked teeth means definitely they will be very clear about their chief complaint. They will tell you exactly, see, that particular teeth is a little rotated. Can you just correct that? That's all I want. They will be very specific. It won't be like a 13-year-old kid sitting in front of you with father and mother saying, my son's teeth coming forward, please take it back. Please take out 4 teeth if you want. Please take it back. No, 25-year-old will be very specific. This 25-year-old female was an air hostess. I practice in a place called Alua. And Alua, for those people from nearby will know, for those people from outside, other states, Alua is a place where which is very close to Kochi International Airport. So I get a lot of these air hostesses and the crew members from the airlines. Now, for them, they can't do this conventional braces. So this is the 25-year-old air hostess in front of me with a complaint of crowding. Now, with this kind of a crowding, I have to look at model analysis. I have a model analysis with an upper analysis value of -5, lower analysis value of -3. You'll be thinking, oh, come on, what is this? Another orthodontic class coming up? No. But why I put these model analysis values, there's a reason for that. I'll talk about the reason for that at the end of the session. This is always my problem. I put something for the end of the session so that people stay till end of the session. So I have around 155 people here. I make sure that at the end of the session, 155 still remains. So I will tell you why I put this model analysis value, upper -5, lower -3 in here. There's a reason for that. I will tell you later. So this is upper arch, this is a lower arch. This is our OPG, this is a CEF. And here again, I have CEF values here. I have the complete SNA, SNB, ANB, Frankfurt mandibular plane angle, I have the IMPA, I have everything here. I will talk about that later. There's a reason why I have put that. So with all the analysis, with all the things done, I decided that this case is ready for a non-extraction alignment. Come on, 25-year-old air hostess, I cannot go for extraction anyway because she was very clear that all she wanted was that correction. So I decided for just an alignment correction. Look at her frontal, look at her profile. Nothing has changed. She's just the same. Profile should not change because they don't want a profile change. So this is a profile exactly the same. I didn't do much about the profile. Now this is her upper arch aligned, lower arch aligned. Let's look at upper arch. This is her upper arch. Pretty nicely expanded and aligned. Pretty nicely expanded and aligned, all with clear aligners. I'll come to that. Lower arch, if you look at it, pretty nicely aligned, but there is some amount of crowding remaining in the lower. Again, I will talk about that later. In one of the disadvantages of clear aligner, I will talk about that. First, let me talk about advantages of clear aligner. Disadvantages come at the end. So this is the lower arch of her. So let's talk about proper clear aligner versus conventional braces, and let's talk about the advantages of clear aligner over conventional braces. Advantages, number one, see, as soon as you say there are no braces, let me tell you, there are so many advantages. When you say no braces means what? There is no bracket placement. There is no bracket placement errors. Bracketing errors is like almost a 45 minutes to 1 hour topic in our full-fledged orthodontic courses. So there is no bracketing error anymore. Then no bracket popping off. Every month patient coming with one bracket loose like this. Doctor, the hook which you had kept up, which is now it is down, it just went ulta. It just broke. So no bracket popping off. Then there is no wire placement. When I say there is no wire placement, there is no wire poking issues. There is no wire changing, nothing. So come on, advantages are like adding on and on and on. The moment I say no brackets, there are so many advantages. The moment I say no wire, there are so many all around the bracket when they come into the clinic. You don't like that. So, I mean, some people like that because they charge around 1,000 rupees extra penalty scaling before seeing an orthodontist. All that. So hygiene is an issue. You've got to know about practice management when you talk about clear aligner. So no hygiene issue. Then adults and celebrities, that is another thing. The moment there are no brackets, there are no wires, let me tell you, the maximum people who are going to take clear aligner liners is going to be adults. And Kerala will very well know that Alua, the place where I am, is a place for all the celebrities in Malayalam film industry. Oh, so many. So they choose this because there are no braces. It won't affect their job. When I say celebrities, not just the movie stars, and there's the TV serial, the ad people, the models, for everybody, it's a big thing. No braces, big thing. And adults. And then retreatment. Whenever I say adult, retreatment adds on to it. Why retreatment? You might have seen so many 35-year-old, 40-year-old, male or female, coming with a complaint of crooked teeth and say that I had done orthodontics when I was in 10th standard, 12th standard, or whatever. So retreatment, the best is clear liners again. So advantages keep on going on and on and on like that. No braces, so many advantages. But let's talk about little technical stuff here. Type of movement. What is the type of movement you get out of clear liners compared to the conventional braces? Softwares that are the digitizing machines, scanners, and then they digitize it. And the software will make individual teeth. See, get individual teeth is under their control. They get every teeth is under their control now. So can you see the handle? The moment you get a handle there, the green thing, tilt, rotate, torque, move out, move in. They can do any movement they want, which you do conventionally in orthodontics. Okay, somebody is annotating on my screen. Sorry about that. I should have disabled the annotation. Give me a second. Sorry, guys. Give me a second. I didn't disable the annotation, so somebody is annotating. I have disabled participants annotating, and let me erase that annotation that has come there. And one second. Yeah. Okay. I have to erase this annotation here. That's it. Done. Okay. So this is about individual teeth control. Sorry about that. So that's whenever you move your mouse around, it becomes an annotation. I should have disabled the annotation when I started, which I didn't do. Sorry about that. So this is individual teeth under the control of the lab guys. They have a handle for every teeth now. Once you get the handle, you can move anywhere you want. Now look at the next video. They can now move one teeth. Look at that. That one teeth, sorry, look at that. That one teeth is now moved to outside, to the arch. The arch form is already there in the software. So they can move. Look at that. Now it's going to move that molar little out. So they are now moving the teeth to the arch. The software is so beautiful that you move too much, the teeth color becomes red, which means you can't move that much. So they move a little, and then they do a 3D printing of it, and then they make a tray out of it. And the tray is placed by the patient. So what I mean to say here is if you move too much and make a tray, that tray won't even fit into the patient. You can only move very little at a time so that one tray goes in. When the tray goes in, that tray, the purpose of the tray is to move the teeth to that particular movement designed by the computer when that tray was designed. If you move too much, the tray won't even go in. That is the beauty of this software. So it is so minute a movement they're doing. They can precisely move the teeth. Let me tell you, that kind of precision is not possible with conventional straight wire technology. So that is the precision when you get it digitized. So whenever you get that precision movement, it is almost equivalent to something called as light continuous force. Light continuous force is considered as the best orthodontic movement, and you are getting that because the computer is deciding a lightest, simplest movement per tray. So if you have tray one, the tray one, when you put it in, tray one is designed to move little. Tray two is designed to move little more. Tray three is designed to move little more. That is how it goes. You can't put tray three directly. No, it won't even go in. You have to complete your tray 1 and tray 2 to go to tray 3. Simple as that. It's like every month patient coming in and changing your wire from O1 to O1 4, O1 6, O1 8, or whatever the wire sequencing which you follow, something like that. You change trays. That's what's happening here. Individual teeth under their control, and they can do any movement they want precisely, more precise than your conventional orthodontic straight wire orthodontic movement. Now, once it is light continuous force, let me tell you, it is faster. It is definitely faster than the conventional orthodontics. So this particular case will take something like 6 to 8 months with clear aligner, when with conventional braces, definitely it's going to go into 1 year. You can't do anything less than 1 year with your conventional braces. So this is the clear aligner doing the alignment in 6 to 8 months. The reason being, it's a light continuous force and precision force applied on individual teeth, which is computer designed. It's CAD/CAM technology, computer aided designing and computer aided machinery. Okay, so that's about the fastness. So I talked about the advantages when there are no braces and all that. I talked about the technology of how it moves. I talked about fastness of it. Now let's talk about some small gimmicks in clear aligner. There's no geographic barrier. What do you mean by no geographic barrier? You treat a patient in Australia, in America, and Germany, no issue. You don't have the patient to come to your clinic every month for wire changing or anything, because you give the complete tray set to the patient. They can just keep on wearing the tray. The software has given a clear printout. Tray 1, April 1 to April 15. Tray 2, April 15 to April 30. Tray 3, April 30, or maybe May 1 to May 15. That precise, it is being given to the patient. Trays are with the patient. So whether the patient is in America or England doesn't matter. So there's no geographic barrier. But when I talk about this geographic barrier, there are a little bit of disadvantages also. I'll come to that at the end of the session. As I told you, I want everybody to stay till the end of the session. So now, whiten as you straighten. Wow, that's interesting. As you straighten your teeth, you can whiten your teeth. See, how do you guys do your conventional home bleaching? How do you do your home bleaching? You got to give a home bleach to the patient. You have to give a tray. In that tray, they have to put the home bleach and put it in, right? It's the same tray. It's the same tray, but of course, with a little bit of differences, okay? That means you got to do a little bit of learning, but this is possible. Whitening. So as the patient wears it at night, tell them to put little home bleach in there and put it in. It whitens as it straightens. Or you want to put it the other way around, it straightens as it whitens. You put it any way you want, but it works. Okay, may not be in the initial active stages of that real movement that is happening. You don't want to put this whitening stuff and all that because there's an active tray. But when it comes towards the passive trays, you can easily think about giving a home bleach. By the time they are in the retentive phase, they are ready for whitening also. Whitening as you straighten. And then strengthening as you straighten. What is strengthening as you straighten? All those hypocalcified cases where you want to give your GC moves. You give GC moves with a tray, right? I mean, GC moves right applications with the tray anyway. It's not like just application like that, where you give the tray. So these are those hypocalcified spots. Mark those hypocalcified spots. Tell the lab guys that in those spots, you need a little bit of a reservoir, for your the solution, the GC moves to stay in there. Again, I'm telling you, for active movement, you want the tray to snugly fit it in for the movement. You don't want those reservoirs here and there during your active treatment time. So you'll have to wait towards your passive treatment time. Those are your retainer times, retainer trays, you can think about strengthening as you straighten. At least you're not weakening the teeth of a hypocalcified teeth. You're not weakening by putting more etching and bracketing and the dirt around the bracket and all that. You're at least not weakening it. Understand that. So strengthen as you straighten is another beauty of clear aligners. So I talked about a lot of advantages. It's not fair for me to get out of here without talking about a little bit of disadvantages also. Okay, it has some disadvantages also. Let's talk about one. Number one, I would say, is like it's like fixed and removable appliance kind of a disadvantage. Like first year, second year, third year BDS ortho curriculum, you might have learned. It is one of the essay question. Cite 5 differences between removable and fixed appliances in orthodontics. In our ortho 5-year exam, it normally comes. So that was actually, they were talking about the Z spring, finger spring, the Hawley's appliance, and all those active removable appliances they were talking about in that questionnaire in your final year BDS time. But this clear aligner technology, end of the day, let me tell you, is a removable appliance. So if the patient is not wearing it, you're not getting any result out of it. If the patient is not wearing it, you're not getting any result out of it. But from experience, I can tell you, from my experience of something like 15, 16 years before I started with clear aligner, that was not when the computer technology was there, when the axo blade real splitting of each teeth and wax alignment, wax mounting and alignment and making a tray concept onwards have been doing clear aligners. Now it's all CAD technology, 3D printing and all that. So at that time onwards, let me tell you from my experience, patients actually wear it. Main reason I would say is, number one, it's mainly chosen by adults and they wanted it, they asked for it, so they better wear it. That's the kind of feeling I get, they are wearing it. Two, I would say it's kind of little costly. It's not as cheap as your straight wire technology. It's costly. So again, you have paid for it, you better wear it. So with these kind of coins, let me tell you, I'm getting beautiful results out of clear aligners. Patients are wearing it. Very rarely I see patients not wearing it. But one thing I see is upper arch alignment happens beautifully. When it comes to lower arch, they kind of little tend to vary. That is one thing I want to cover in the beginning. In that particular case, which I showed you in the beginning, lower arch alignment was not up to the mark. Upper was perfect because she was happy with the upper arch. She was not bothered about the lower arch. Lower arch, she wore it for me. Lower arch, she came every other month to me to collect the tray for me, for giving me money. But according to her, treatment was pretty much done with the upper arch. That is another thing. Lower arch, they tend to come down in that enthusiasm a little. So disadvantage, it's a removable appliance end of the day. So if you look at it, are we going back to your old era of our finger spring, is a spring, canine retractors and all that stuff? Yeah, you want to look into that way, you can look into that way. So that's one disadvantage, removable versus fixed. Another disadvantage is that you need to have some diagnostic knowledge yourself. This is one point that every lab people are against me. Many lab people have approached me as a speaker for clear aligner for their lab. I am not a speaker for any lab at this point of time in the country because of one point here. You need good diagnostic knowledge. Because company says, every company normally says, all you need to do is take an impression, send it to us, we'll take care of it. I don't really want to follow that concept. You got to be masters in what you're doing. You got to be knowing what you are doing. See, for example, you have your endodontic cases in there. You have a endodontist coming into your clinic, but you see your case, and you refer it to your endodontist. You tell the patient, come on so-and-so day when my endodontist is there. But you already know about that teeth. You know that disfurcation involved. You know that it might go for extraction. You have a lot of idea about it. But you're just giving it to specialists. See, specialists are ready to do. They are coming in once a week or twice a week to do work. They are ready to do any kind of challenges because for them challenges because it's your patient, not his patient. So when they are ready to take up any challenges. but you should be able to have an idea about whether this case is ready for clear aligner. Is it a case okay for clear aligner? You should be having some idea about it. Now, to complete that part, diagnostic knowledge, let me talk about one case here. This is another case presentation now. I'm almost done. My lecture is done. Another 5-10 minutes, I should be done. This is one more case presentation here. This is a patient with upper-lower crowding. This is the upper arch, the lower arch. Now I'm going to talk about why I kept this model analysis values and all there. As a general dentist, you should be having an idea about what is model analysis. How much space is available for how much teeth? It's not a big thing. It's not a big thing. I would say our curriculum makes it a big thing. Our curriculum made cephalometrics so big that people hate it. Our curriculum made model analysis some real big thing. Nobody does it. Every general practitioner should have an idea about the millimeter available and the millimeter required. Very simple. Just a little bit of learning of model analysis. Any YouTube video, you can learn that. You should learn that. That's why I've put this model analysis here. If you look at this case clearly, upper arch has a -4. Whenever it's minus means it's crowding. Okay, so upper arch crowding is less, lower arch crowding is a little too much. Now, upper arch crowding of -4 means anything below 5 is like a little bit of expansion. You can get a pretty nice alignment. But anything above 5, above 6, we are looking at slowly into extractions and all that. So we are talking about upper arch alignment okay. I mean, crowding okay, lower arch a little too much. Then cephalometric analysis. Again, cephalometry is a big thing here. Very difficult. SNA, SNB, oh my God, the moment I read about it, I sleep. That is the concept about cephalometrics. But every GP should know about whatever, whether you're an endodontist, you should know about the basic of IMPA at least. What is IMPA? Incisor relationship to the mandible. How much is this incisor out or in? That's all, not a big deal. It will be out too much. So that is why I was talking about this little bit of diagnostic knowledge, little bit of learning, little reading, and little bit of some courses you want to attend. This should take care of it. We are coming out with a heavy 5-hour clear aligner webinar soon. It will be announced soon. We are planning on it, a complete coverage of clear aligner, 5 hours, including the CAD/CAM technology, including the interproximal stripping, live demo of IPRs. We are planning everything pretty soon. We will announce that soon. So once you have an idea about this crowding, this particular case, I understood that lower arch, if I try to align, I might make it very unstable. So what I did is I told the lab guys to take out one lateral incisor of that patient and align it for me. That's the alignment done by the lab. This is the kind of report you get from the lab, from clear aligners. Let's look at the top view. I asked them to extract one teeth and told them to align it. See, this is how they align. This is the computer-generated alignment. That's the beauty of clear aligners. Even your conventional cases, you can take impression and send it to them and tell them to show me how it looks after alignment. That's a beautiful tool for your patient convincing. So this is one insight extracted. This particular case, if I had taken an impression and given to the lab without any prior talking about the diagnosis, I bet you, the result from the lab would be, sir, we will do upper lower alignment, but lower arch, I want you to do interproximal stripping. It's fine. Interproximal stripping is fine. But I am a person who tried to avoid IPR whenever possible. Because the moment you do IPR, interproximal stripping, you're talking about the contact point between two teeth becoming a contact area. Whenever the contact point becomes contact area, that's the place for cavity formation. That's a place for cavities. 5 years down the line, patient is going to come with black cavities on those IPR done teeth, I bet you. Especially with our Indian kind of scenario wherein they walk into the clinic only when they get pain or only when they see a huge black thing. Sir, there's a small black thing here. It's not small, it's a huge black thing. They've been walking around with that black thing for 1 year. But sir, I didn't have any pain, sir. That's why I didn't come. As long as that mentality is there in here in our country, don't do too much of IPR. If you're doing IPR, please make sure you do fluoride therapies, GCMOs, legitimate checkup, every 3rd month follow-up. Call the patient every 3rd month. See for the joint, see for the contact areas, clean up, and that kind of a meticulous follow-up is required if you're doing too much of IPR. So IPR, I'm not against it. I'm doing IPR. As a matter of fact, we are doing a live demo of IPR in our coming up webinar. But this is something to be avoided. This case where I wanted 7 millimeter, I didn't want to do IPR. So I decided to take out one teeth instead of doing IPR. So this is the case. Profile unchanged. Obviously, profile is not supposed to change, as I told you. It should not change the profile. And this is him aligned after treatment. Look at the alignment. Look at the alignment here. Now, if you look carefully, upper arch, I have widened it a little. I have a little more widened arch, no extraction. But lower arch, look carefully, one teeth missing. I have a teeth missing here. So no IPR done. He is safe, but I have a missing teeth there. I got it aligned with one extraction. So that is another disadvantage, I would say. I wouldn't call it as a disadvantage that you should be having some diagnostic knowledge. That is not a disadvantage. You have to learn more about a little bit of orthodontic basic diagnosis. I'm not telling you to learn about the torque and the tip and all that of individual teeth with straight wire brackets. I'm just telling you to know diagnostic knowledge, which like a little bit of lateral ceph, a little bit of model analysis, photo analysis, your nasolabial angle, mandibulabial sulcus, little bit of analysis should give you a lot of idea about how to treat the case. Another disadvantage, I would say, is that you need good connectivity with the patient. What do you mean by connectivity with the patient? You know what? I am in touch with my clear aligner patients more than my conventional patients. Clear aligner patients, what touch you need? Every month, they just have to come and change the wire and go, change the elastic chain and go. That's all, right? But in clear aligner cases, you got to be good connectivity. They might be abroad, they might be in Australia, wherever they are. I get these WhatsApp messages. I send messages to them every time. See, it's time to change from tray 8 to tray 9. Please feel free to contact me in case of any issue. That kind of connectivity you need with the patient. Please don't do it as a simplified methodology of orthodontics where you just give all the trays to the patient. Bye-bye. Give me my money. I want to get out of here. I'm done. My job is done kind of a concept. No, I will not recommend that. I always suggest that you have to have good connectivity with the patient. You should be really in contact with the patient. So please send a picture of the front teeth to see and evaluate the change. These kind of WhatsApp contact is required. Again, we have charged a little too much. You better be in good contact with the patient. That's what I say. Otherwise, clear aligner backfires completely. Clear aligner is a failure if you do not have good connectivity. This is again one point I'm stressing, which no lab tells you. Lab normally tells, doctor, take an impression and give it to us. We will take care of the remaining. I hate that concept. So you need to have good connectivity with patients. So this is about the disadvantages, removable versus fixed. I told you, you need to have some diagnostic knowledge and you need to have good connectivity with your patient. There's actually one more disadvantage that I'm sure will come up in the question chat box soon about the cost. See, it is costly. But cost is never ever considered as a disadvantage in any dental procedure. That way, if you look at it, frenectomy, conventional scalpel blade, and laser is costly. Is it a disadvantage? No. That depends upon your practice area. That depends upon the type of practice you have built up. If you have built up a low level and you want to stay right there, you stay right there. Then the big things will be a disadvantage for everybody. That's practice management again. The moment you up the level, increase the charges, be professional, come up the level, then it's never a disadvantage. I mean, see, the place where I practice, 90% of the people in my area, root canal charges around 2,500 rupees, okay? 2,500 rupees. We have people from other countries also attending. And my clinic, the root canal charges 6,500 rupees. So that's like 4,000 rupees increase right there. But there are a couple of clinics in my place charging 10,500 to 11,000 rupees per root canal. So his level is even above my level. So that's the way you come up in dentistry. You decide to be down there, you'll be always down there. So you cannot put money as a disadvantage for any treatment plan. There are takers for everything. Understand that. There are takers for everything. This small place called Alua, where people are doing 2,000 rupee root canal, has a Jaguar showroom, has a Mercedes showroom, has a BMW showroom, and there are takers for all that. What I mean to say is, there are takers for everything. So I wouldn't put money as a disadvantage. I'm sure in the chat box, those questions are going to pop up soon, how costly it is. It is costly. It is costly compared to conventional braces. But once you know the advantages of it over the conventional braces, let me tell you, cost doesn't matter because patients, once they're convinced, they're ready for it. Who all are ready for it? That's what I told you. Adults, celebrities, all that. There's a group there ready for it because they don't want to put braces and get out into their business and all that. They want to do it silently. If there are takers for Botox, jawline correction, come on, there are takers for everything. So I wouldn't put cost as a disadvantage. That's it, guys. That's it. This is it about the lecture. A little bit of advantages of clear aligner, little bit of disadvantages of clear aligner, and one final thought here. One final thought of clear aligner I would say is, do not depend on the lab completely. If you do that, that might end up in some kind of a disaster or backfiring. And you tend to say clear aligner is a failure. It won't work. It works. Case selection and the right diagnostic values, let me tell you, it works. Do not depend on the lab completely. As I told earlier, lab guys will give you some kind of a diagnosis. They will tell you do IPR from premolar to premolar, all the way IPR. You get like 5 mm space. Then think about some other modalities. Learn a little more about model analysis. You should be able to do that. Let me tell you, I start off with the point, change is inevitable. Guys, change, you've got to change. Patients are going to come to your clinic one day with a paper cutting. Doctor, do you have this technology in your clinic? You should be able to answer to it at least. So that was the purpose of our webinar on clear aligner. We are coming out with a heavy session on clear aligner. It will be announced soon in the group. Those who are interested have to respond immediately. We will put you into that. It's going to be a huge 5-hour with all the demos and things and all that. So let me wind up here with the point, change is inevitable. If this monkey and this dog can make a change during this lockdown period, anybody can make a change. Thank you very much. Now, I guess Dr. Joby lost his connectivity, and oh, Joby's here. Let me. Oh, Joby is here.
Yeah, yeah.
One second, Joby, you're here. Oh, okay, good.
Yeah, yeah.
I saw
My
a
net
message in
is.
between that you
Yeah, yeah.
got disconnected. So
Yeah,
good, good. Okay, Dr. Joby, thank you so much. I'm done.
yeah, yeah.
Is
There
there
are
any
some questions.
questions around me? Let me just check the chat box. Yeah, chat box has some questions like what is it? External causes midline shift. Oh no, it's not exactly midline shift. It is not going to be the conventional midline anymore. Conventional midline is what? Midpoint of the central incisor upper meeting with central incisor lower. It won't be that. It will be upper central incisor meeting with the midpoint of the lower incisor. With midpoint of the lower incisor. I can actually quickly go back to the case and show that this is it. This is going to be somewhere the midline of the lower central incisor is going to be the midline. It is not going to be the conventional midline. You are right in a way, but it is an accepted thing. There are articles to prove that single tooth incisor extraction is possible, is approved by the American Association of Orthodontics. So it's done. It's possible. Yeah. So it's not exactly a midline shift, you call it. Then, sir, in these cases, there is slight shift of midline. That's again same thing. Sir, can deep bite and spacing be treated using midline? Okay. Deep bite. Deep bite correction using clear aligner may not be a very good go. Because, see, first of all, skeletal corrections are not meant for here. So whenever you see a deep bite, the difference between a skeletal deep bite and a dental deep bite. If you're talking about a pure dental deep bite, no skeletal, how do you confirm that? That's cephalometrics again. You got to look at your ANS PNS plane, your maxilla, ANS PNS plane, the angulation, the mandibular plane angulation, which will tell you whether you have a skeletal problem there. If you have a skeletal problem there, clear aligner may not be the right thing. But if it's a pure dental deep bite, there are even methodologies, upper tray with a biplane, anterior biplane. Upper tray with an anterior biplane is also available, where in the posterior region is slightly, and you tend to supra up the lower teeth and all that. But to be very frank, if you see too much of deep bites and all that, may not be the right case for clear aligner. This is ideal for pure dental issues. Any chance of discoloration of aligner while using? Discoloration of aligner. Not teeth, aligner. I doubt. No. See, you hardly use it for like 15 days or so, 15, 20 days. No discoloration is going to happen in 15, 20 days time. But the final tray, the retainer tray, which they wear for like 6 months or so, I'm sure that question is going to come soon. So I want to answer that now. Retention protocol of clear aligner is exactly same as a retention protocol of conventional orthodontics. After conventional orthodontics, you put Hawley's appliance or Essex retainer for 6 months. You got to put Hawley's appliance or the same tray for 6 months. So the methodology is the same. Now, when you put for 6 months the same tray, you are right. Some kind of color changes, cracking and breaking can happen. But active trays, 15 days, 20 days, no change. I have never seen any discoloration. If there is a patient who has received a full set of aligners and has moved to another location, faces in relation to fitting of one of the aligner, what can be done to get the patient back to track in? Oh, wow. That's a very good question by Donna Elizabeth. I'm sure she's using it. I'm sure she's using clear aligners. This is a very common issue I face. As a matter of fact, I got it from Dubai last week. This patient is wearing clear aligners, but now he's ready to move from tray 9 to tray 10. And when you put the tray 10, just not fitting. What to do now? You have a problem. Sorry. The solutions are, one, tell him to wear the tray 9 itself for some more days and then come to tray 10. It might work. He may not be very strict. He may not have been very strict with the tray, and I am one thing. But this case, I confirm that, no, that's also not the thing. It is something to do with the manufacturing. Then what you do? Options are, you will have to ask him to go to a clinic in Dubai. That's what I did, and take an impression and send it to me. I gave it to the lab. The lab guys analyzed it, and they said, yeah, that was a manufacturing problem. They gave one more tray, and I sent it back. I'm planning to send it back to Dubai. So possible. There will be courier charges and all that. But if it is purely lab issue, the lab will take care of that normally. If it is a patient issue, let me tell you from my experience, it's normally patient issue. Doctor, I missed my 10th tray in the flight. I was flying from here to here. Now, celebrities, the way they talk. I was flying from here to here. I just took it out to grab a coffee, and then I put it. Then I wanted to put it back. They took it in the garbage. I hear all kind of stuff. Okay. Now that is a penalty. They got to charge. They got to be bearing the charges of that. So they have to now go to a clinic, take an impression. Now in Australia, Germany, and even US, what's happening is they go to a clinic, they get an intraoral scanning done. It's just an email. It comes to me as an email. I send it to the lab, forward it to the lab. The lab guys, that email can be made into a 3D print, and they can make a tray out of it. So that's number two. Another third solution is that whenever the original thing came to you in a box, many lab gives the 3D print along with it. 3D print, keep it with you. Do not give it to the patient. So the patient says he lost the 9th tray, take the 9th 3D print or 8th, whatever the 3D prints available, take that 3D print, give to the lab, tell them I need another tray for this particular 3D. Now you got a tray, send it to them. So this is what I told you. You need a good connectivity. You've got to be in close contact, even more close contact than your conventional orthodontic cases. Hope I answered your question, Dr. Donna. If it is specific to some particular case, you can come to me personally on that. So do the patients need to wear the aligner 24/7? Yes, patients have to wear the aligner 24/7. Braces are on there 24/7. So this has to be on there 24/7, but not while eating. Even while having a hot coffee, they should remove it. And again, from experience, all these celebrities, what they say is they wear it 24/7, except while the final take, when the director says it's going to be the final take, they remove it, because especially the TV serial people, they come so close up in the TV serial, so it might get a reflection there. So they tend to remove it for the final take, or the rehearsals and all that practice, they wear it. Just for the final take, 5 minutes, they remove it. That is the report I am getting. So if they can wear it 24/7, anybody can wear it 24/7. Are there any exceptional cases with relation to case selection? I would say exceptional cases would be the skeletal cases. Skeletal class 3 compromises, skeletal class 2, division 2 compromises may not be the right case. And then all that severely periodontal involved where conventional braces are contraindicated, this is also contraindicated. So what about lower midline shift and lower crowding and deep bite can be, that's what I told you. Deep bite, again, if a skeletal deep bite may not be very good to try with this. But midline corrections, lower crowding, amazing. It works wonders. When changing trays require, hello doctor, when changing trays is require new impression. No way, no. You don't have to take new impression. Just have to change from tray 1 to tray 2, tray 2 to tray 3. They just have to continue. How strong are the clear liners? Strong. Yeah, you can't like stand over it, it will break. But otherwise, and you can't eat with it, it might break. But for that, it is strong. I mean, how much strength do you need for a clear liner? If you're talking about, is that question related to some bruxism forces and all that? This tray may not take it up, because this comes in various sizes, 0.6, 0.7, 0.9, there are some sizes for it. These kind of trays may not take up the bruxism. Bruxism trays are slightly different from the clear aligner trays, if that was the reason for your question about the strength of it. How much is needed in a day to wear? I'm sure Dr. Abhishek is talking about the time I told you, 24/7. So are the whole set of clear lines delivered together, or impression has to be, okay, now that's again a good question. Now you have a crowding alignment treatment in front of you. For example, the case which I showed you, 8 months case, the first case which I told you, 8 months case. The 8 months case normally will have something like 21 trays upper, 21 trays lower. So I personally do not give all the trays together and get all the money and say, ever buy. No, I tend to give tray depending on their schedule. So that was an air hostess. Air hostess in Kochi, international traveling means once they're out of Kochi, they'll be back in Kochi in like 60 to 70 days. That's the cycle they fly. So I give maybe around 6 trays to 7 trays to them, but they have to come back to me. Celebrities, I'm in Chennai, I can't come to Aluva all the time. You have to come to Aluva. There's no other go because I have to check every stage, and you don't actually, there's nothing to check. You can actually give the whole tray. But that's not the way it should be. That's practice management again. You should be having good control over what you are doing. It's not just for making money. I personally feel nothing in the industry should be aimed at only making money. You should be doing good job. You should have self-satisfaction when you do something. That is the point here. That relief you get, that feeling you get when these people talk about their smile correction that has been done and all that, that is what you need. It's not that money that eventually matters. So you don't give all the praise together and just collect all the money and finish off the case like that. Some of the aligner systems specify tooth attachments as tooth attachments are those small composite attachments which we are covering in the main webinar. It is not in the scope of this particular webinar. Tooth attachments are those small composite pellets we place on the teeth, because when you want to move a teeth, when the tray fits in like this, when you try to move a teeth, it's difficult when the forces get dissipated. So you put an attachment there, a small ball, put the tray in, there is a single point contact on that teeth which produces a rotation of the teeth better than a flat contact with the tray. So that's the advantage of these attachments, which if they say it is needed, it's better to go for attachments. Clear aligner extraction cases, you can do clear aligner for extraction cases, but I wouldn't recommend for the 4 bicuspid extraction retraction cases. I'll be like 50 trays up or 50 trays lower, that's too much. That enthusiasm, that interest might wear down, and eventually patient will end up with some gap here and there, and you will be the fault eventually that I did orthodontics, but there's a lot of gaps remaining and all that. So, but that lower single teeth extraction, very much possible. White spot lesion with clear aligner, no, it won't happen with clear aligner. It would have been already there. And that will go off if you ask the patient to use GC moves in between. About maintenance of clear aligner, nothing much. You just have to take it out every morning when you get up, take it out, clean it, put it in the box, have breakfast, everything, and come back and put it back again. Nothing, no other maintenance. Keep it in that box all the time. How much the lab charge for the diagnosis? How much that? Okay. How much the lab charge for diagnosis? Now that varies from lab to lab. Some lab really charges like 2,500 to 5,000 rupees for giving you complete report. Some labs do not do that. They just give you a report. So that you have to choose the lab. There are so many labs. And the lucky with we people, I would say in Aluva here is the major players in clear aligners are all in Kochi. The Dentcare clear aligner, Max Dent clear aligner, the Clear Bite clear aligner by JJ Orthodontics, Clear B clear aligner, everything is in Kochi. 15 kilometers circumference to me. So it's highly competitive now. So they are ready to do anything if you can give an impression to them. How much is the charge for a complete set of aligner? Again, I cannot say that. That depends on the case to case. A 15 tray, minimal alignment, minimal diastema closure, 15 tray lab charge can be in the range of around 20 to 25,000 rupees. But a heavy movements can be 40, 45, 50,000 rupees lab charge alone. Yeah, it is costly. I told you it is costly. If the space required in the max is -5, how do we plan the extraction? Yeah, see, -5 in upper, again, you can do a little bit of premolar area expansions. You have to look at the intermolar width, interpremolar width, see whether a little bit of expansion is possible, or a little bit of stripping in the premolar area should take care of -5. I would have been little worried if that question was -8 or -9. You're talking about one premolar extraction. No, don't do that. Don't do unilateral one-side premolar extraction on the upper. You will mess up the case completely. Can unilateral crossbite and spacing be treated with bacchanal? Cross spacing can be treated. Crossbite, little difficult. You have to have temporary bite openers and then wear this. I would rather think about spare clear aligners. In which lab you give your work, I give to Dencare clear aligner, Maxton clear aligner, Clear by clear aligner. I give to everybody. Whoever gives me the best rate, I am ready to go by it. Doctor, when starting the 5-hour aligner program, I'm interested. Oh, okay, definitely. You are there in one of the groups, I'm sure. So you will get the notification in that. Is bruxism a contraindication? I would say yes. But in bruxism cases, straight wear brackets are a definite no-no. So in this way, if you look at it, it can be a treatment for bruxism also. You never know. You might see bruxism getting corrected after your clear aligner treatment gets over. Because for bruxism, what is the treatment? Eventually, it's some kind of a tray only, right? But that tray is normally a little more softer bottom, softer up, a harder down kind of tray. So it's slightly different from the clear aligner tray, I know. But eventually, it's some kind of a plastic kept between the two teeth. So this can be a treatment for that. So in this case, there is slight shift of midline. I think we covered that. I think I am done with the questions. Thank you so much, guys. Dr. Joby, are you here now? I think he lost his connectivity again. Yeah, he had told me, had warned me that he has a problem with his connectivity. So that's it, guys. We are done. Anything else to ask? Please feel free to ask in the questionnaire in the WhatsApp group. Please feel free to do that. And for any pediatric dentist around in this, if there are any pediatric dentists listening to us, the American Association of Pediatric Dentistry annual convention is on in Nashville. It's actually a virtual conference this year, and myself and Dr. Joby presenting, having two talks tonight. One is mine, one is Joby's. That's tonight, American time, 3 p.m., something around 12:30. We got to sit late night today. We have talks tonight. So those are pediatric dentists around here, try to log into AAPD website. You might be able to check out that. Thank you so much for being here. See you all soon with some other topic. Good night.